Hi everyone, thanks so much for your interest in my talk today. My name is Ray and I work at Cats Protection, which is a UK feline welfare charity. I'm going to be talking about the long-term effects of prepubertal neutering and how we're looking to fill the evidence gap for veterinary stakeholders. So I probably don't have to preach about the benefits of neutering at a population management conference. Obviously in the UK for felines we do use neutering as the major form of population management, and it is estimated that around 95% of owned cats are neutered. It also has additional benefits such as the prevention of long-term disease, things such as cancers, and the decrease in undesirable behaviours for owners, things such as spraying or aggression between conspecifics. So historically, neutering has been done at 6 months. However, recommendations from the CAT Group, who are a coalition of feline welfare charities and organisations, changed this recommendation to 4 months in 2006, which is actually nearly 20 years ago now. And the reasons for this are numerous, but they do include that cats seem to recover more quickly from surgery when they are younger, and they seem to demonstrate signs of less post-operative pain. Vets often report that the surgery is quicker and easier as well on smaller individuals. And there are additional benefits for population management. So the prevention of accidental litters. So cats can get pregnant at 4 months old, and it is thought that about 80% of litters born to owned cats in the UK are accidental. So by neutering earlier, these can be prevented. And this has an impact on other cat populations also. So a recent modelling paper completed by my colleague Jenny MacDonald demonstrated that how by reducing the neutering age from 6 months old to 4 months old, even when neutering rates remained constant, we saw a decrease in the owned cat population as well as the shelter cat population, stray cat population, and free living unowned cat populations. So if you want more information on that model, Jenny does have her own talk being held on Thursday. You can learn more about the methodology, about the insights that we can gain into unowned cats in the UK through this model, and the way we can use it to look at the impact of different interventions. So general attitudes towards 4-month neutering in the UK are positive. We see around 70% of vets are comfortable neutering at 4 months old, and around 50% would recommend 4-month neutering to their clients if their practice policy permitted. So whilst these numbers are high and they're going in the right direction, we would like them to be higher. We would like 4-month neutering to be the norm. And so to do so, we need to overcome a couple of barriers. So the concerns that were found in a paper from 2020 include concerns over general anaesthetic and analgesia, and also around surgery and surgical techniques. We think this is because when new veterinarians are being trained, they are typically carrying out neutering on older cats, and it isn't until they get to practice that they start to work with younger cats. And so there is like an element, I guess, of additional training that is required for vets to perhaps feel comfortable with that 4-month neutering. Now, thankfully, there is a resource for these two issues, and that's hosted on a website called CatKind, who are a coalition of animal welfare charities who are promoting 4-month neutering, and we'll talk more about that later. Other concerns include general concerns around changes to the growth and development of cats that are neutered early. So we do know that neutering in general predisposes cats to obesity as they age and throughout adulthood. So there are concerns that by neutering earlier, we increase this risk factor. So far, the evidence suggests that that's not true. However, there are definitely limitations that we have identified within that literature, and they include things such as the use of owner-reported data rather than clinical measurements, only using one measurement of body condition score or weight, aka like a cross-sectional study design. No longitudinal studies in owned cats. There are some in shelter cats. However, we know that that's quite a different environment, so owned cat studies would be preferable. And then also seeing obesity treated as a binary measure within studies. So are the cats obese, yes or no? And so knowing this, we set out to design a study which could hopefully plug some of these literature gaps. So our study gained its data from the Bristol Cat Study. The Bristol Cat Study was a first of its kind longitudinal cohort study run by the University of Bristol and part funded by Cats Protection. It's followed cats that registered between 2010 and 2013 when they were between 8 to 16 weeks old throughout their lives. Owners have set intervals in which they complete surveys, and they also submit veterinary data, including body condition score and weight, which are our variables of interest here. The body condition score that we used was on a scale of 1 to 5. It was analysed categorically, and the body weight we used in kilograms. In terms of our explanatory variables, we looked at demographic details, age, sex, and hair length. We looked at external variables, age of neutering, acquisition source, and season. And then we recognise that other time-dependent variables such as diet and lifestyle and disease are probably very important. However, we couldn't include those in our study. The owner data and the vet reported data were not recorded at the same time. And so without any sort of information on how we account for lag effects or how things might change in between those two measurements being completed, meant we couldn't include them, unfortunately. However, future studies may be able to build those into their analysis. In terms of other data exclusions, cats that had an unreported age or date of birth because we couldn't calculate the age at measurement or the neuter age. Cats that were detailed to be pregnant at any point in case it changed their morphology or the way that they were predisposed to gain or lose weight. Cats that were purebred simply because, again, difference in morphology might impact body condition score. There was one cat that had one measurement of a body condition score of 1, and so that was excluded simply due to sample size. And hair length data for cats that were reported to have medium hair. It's quite an ambiguous description. Cats are typically listed as being short hair or long hair, and there are only a few cats classed as medium hair, so we chose to exclude that from the analysis. So in terms of our study population, we had 584 individual cats, and that was across 466 owners. Owner ID was nested within the model and accounted for. So then 85% of those cats were short-haired, 44% were female, 25% were from a shelter, 12% were listed as being strays, and the rest were categorised as other with regards to their acquisition source. In terms of the veterinary data, we had 2,410 body condition scores and 2,073 body weights. There was between 1 to 12 body condition scores per cat, but the median was 3. In terms of the age of neutering, we had 21% of cats neutered at 4 months or younger, 36 at 5 months, 34 at 6 months, and 9% between 7 to 12 months. And then with regards to the actual clinical measurements, 67% of cats and records were given a body condition score of 3, which is ideal on this scale, and 85% of cats had at least one measurement of 3. 30% of the body condition scores were above ideal, and they were predominantly body condition score 4 at 26%. We had very few cats that were underweight, under ideal. It was only 4% of records with a body condition score of 2. Then the mean weight across all measurements was 4.73 kilograms. So our paper is currently undergoing peer review, but our top level results are as follows. So with regards to age of neutering, we originally ran the models with 4 separate age of neutering categories, and they were 4 months and under, 5 months, 6 months, and 7 to 12 months. They provided us results such as this, where you can see that the 4 month and under, 5 month and 6 month categories are showing very, very similar trajectories for cat weight as they age. They are essentially on top of each other. However, the category of 7 to 12 months and the late neuters, they are quite different to the other few categories. Because of this, we chose to rerun the model with just 2 age of neutering categories, which would be 6 months and under and 7 to 12 months. So which variables were significant? Age of neutering, obviously, as we can see by the previous slide, there were significant differences between cats that were neutered at 6 months and under and those that were neutered at 7 to 12 months, those that were neutered later. We saw that the ones that were neutered in the 7 to 12 month category experienced a less rapid age-related increase in both body weight and body condition compared to those that were neutered at 6 months or earlier. In terms of age, we saw that it was significantly predictive of body condition score and body weight. There was increasing body condition score and weight as cats aged, and that lasted up until around 8 to 9 years when measurements actually started to decline. We didn't have much data past this age, so we don't know how that trend continues, but it's definitely something to look out for in future studies. In terms of sex, it was significant with its interaction with cesium. So generally males weighed more than females, probably to be expected with sexual dimorphism. However, females had lower body condition scores and body weights in the summer and autumn, whilst males remained more consistent seasonally. This was a bit surprising. We might have expected to see seasonal fluctuations in females that were not neutered. However, in neutered cats, to see this fluctuation, was interesting. And then in terms of hair length was the only predictor that only predicted one of the outcomes, so that was body condition score. It was not predictive of body weight. It's likely due to the subjectivity of body condition score. Even this is with clinical data by trained veterinarians. So cats with long hair, they were more likely to be given a lower body condition score compared to short-haired cats. So how is this data clinically relevant? Well, in terms of age of neutering, it's likely that post-operative weight management advice that is currently given out for cats neutered at 6 months is also applicable to cats that were neutered at 4 months and younger or 5 months. And that's just because we saw the similar body weight and body condition score trajectories throughout those cats' lives. For cats that were neutered late at 7 months or older, they may need different weight management advice. In terms of age, we know that cats typically start to lose weight at 8 to 9 years. It's demonstrated in this study, but also in other literature. We just need to be aware that this may or may not be associated with disease. Weight loss is typically symptomatic of illnesses that start to take hold around this age, so considering it in context would be important. It's also a good idea to just be mindful of the fact that cats that are neutered late who weigh less may be more impacted by this weight loss than cats that are neutered later. More studies are needed in this area. It's just something to be mindful of. In terms of sex and season, the way that season may impact body condition score and body weight in females should be considered. Obviously, as we mentioned, it's possible that this would be assumed for cats that were not neutered. However, for cats that are neutered, it does also seem that these variations are present, and so looking at perhaps changes to body condition score and body weight over a long term rather than a short term to account for the seasons might be pertinent. And then for hair length, especially when it comes to long-haired cats, it may be beneficial to use both body condition score and body weights. It seems that long hair may distort the perspective of cat body shapes for veterinarians, leading them to perceive the fur to be sort of responsible for more of the cat size than it actually is. So by using body weight in conjunction with the body condition score, we may be able to track the size and shape of these cats more accurately. So our data adds to a growing body of evidence around neutering at 4 months. This evidence has been collated by Catkind, which is the organisation I mentioned earlier, who are promoting 4-month neutering. And the summary of scientific evidence currently covers a host of different topics, and that's growth and development, weight, behaviour, urinary issues, and surgical concerns. And the outcome of all of this so far is that the evidence suggests there's actually no greater risk of neutering at 4 months compared to 6 months. The website also hosts resources which are more practical, things such as the Kitten Quad app, which is an app which can help calculate anaesthetic dosages for smaller individuals. And there's a UK veterinary database as well, which has links to all the practices in the UK which carry out 4-month neutering or can help other practices work towards carrying out 4-month neutering as standard also. Finally, there's links to videos, there's articles, there's references, and there's more. So if 4-month neutering is something you are interested in, definitely check out this website. There's lots of great information there. and a link to that site here at the bottom, catkind.org.uk. So that's everything from me today. A massive thank you for watching. A big thank you to ICAM for hosting this presentation for me, and of course also to my colleagues who have worked with me on this project. My email address is listed here. If you have any comments, queries or questions, please do get in touch. The paper itself is currently under peer review, so I can't link you to that yet, but hopefully within the next few months that will be available. Enjoy the rest of the conference and hope to hear from some of you soon.